On Wednesday, an Arizona patient was the first to receive a new device aimed at treating coronary artery disease. It's called a dissolving heart stent, and unlike a metal stent, which stays in the artery, this dissolving stent loses much of its structure within a year, completely dissolving within 2 to 3 years. But it comes with a significant caveat. It hasn't yet been shown to be safer than metal implants and could be years before scientists have sufficient research. CBS News Chief Medical Correspondent Dr. John LaPook is here. So, John, you talked to Dr. Greg Stone,
Right.
a leader of the Abbott-sponsored studies that led to the approval of the device. Explain, first of all, what a stent is. What is it that the original stents are like, and what is different about this new stent?
Right. So it can be a little bit confusing. When somebody is having a heart attack or a near heart attack, if you put it, it closes down, right? There's sort of a clot, this plaque in there. And so it was found that if you put a balloon in and kind of smash through the blockage and then put sort of like a metal cage, a stent is like a metal cage, which is corrugated, to keep it open, that actually can prevent a further heart attack, a future heart attack, and help save your life. That's if you're having a heart attack or near heart attack. In other situations, it's less clear. One of the problems was, though, they thought that, well, after, a year or two, maybe you needed to take, there was a risk of it closing down again, and for the first certain number of months to a year, you need to take medicines like Plavix or aspirin to keep it open. But they figured after that you were in the clear. Well, it turns out that's not true. It turns out that every year there's about a 2 to 3% chance of a major cardiac problem following these stents. That's a heart attack or a blockage again in the same artery that was supposedly open. So they were trying to think, well, what's the problem there? What can we do to help that? And the analogy that Dr. Stone is a former colleague of mine when I was a New York Presbyterian, and he said, imagine you break your arm and you put a cast on it, and then the cast comes off normally in 6 months. The arm will heal in a few months. Do you leave it on for 6 months? Do you leave it on for a year? Do you leave it on forever? Well, that's what we do with these stents. Long after the artery has recannulated, has opened up again, hopefully, you're leaving that stent in there, and that can lead to further problems. So they said, there's this polymer, and we'll put it in there, and it'll dissolve over a number of years. And so after 1 year, they did a study, and they showed there were some problems with it clotting up again if they put the stent in too small of an artery. But if you got rid of those where they mistakenly really put it in the wrong size artery, that actually was comparable to the current stents that are now used.